healthcare plan. Let's listen in.
Through the president's speech. Her story took me back to a place that I haven't been in a long time. I remember standing at the foot of my mother's bed as she told me that she had breast cancer. As a young boy, I didn't know what that meant. Thank God she had health care insurance. I look at this now as a grown man with a young family, and I wonder what my life would have been like if my mom didn't have health care insurance. How would we have paid for it? Would I have been able to go to college? Would my family, my middle-class family, been able to support her treatment? Well, she's living today. She's with us. But I think what would have happened and what could happen to those 39,000 people in my congressional district who don't have health care insurance, or the 9,800 people in my congressional district that are living with pre-existing conditions. They're one medical emergency, one bankruptcy, one diagnosis away from complete and utter economic chaos. I remember when I was serving overseas, when Tommy Thompson flew to Iraq with one of many billion-dollar checks in hand to make sure that Iraqis, every man, woman, and child, had access to health insurance. If in this job I can save one life, one family, one person, one Natoma, this job is worth it. There's too many politicians who are worried about their future instead of the future of the families who are standing behind me and the families like Natoma's. A lot of people are telling me this decision could cost me my job. There's been a lot of lies and fear-mongering. This town is wrought with that these days, but leadership on both sides are worried about who's going to take the house, who's going to keep the house, who's worried about Natoma keeping her house. She told me in a conversation that she's worried about losing her home to foreclosure because she has no health care insurance. Natoma is my constituent, just as these families are here today. Mom survived breast cancer, but I remember her always saying to me, "Don't tell me what you believe in. Show me what you've done, and I'll tell you what you believe in." After we do this process, we vote on this bill, and we let the American people know that we're trying to make a difference in their lives. But there's just one person today I want to make proud. I want my mom to know I'm standing up today, and I'm doing what I believe in. Natoma, I wish you could be here with me today. But don't let these statistics and the lies tell the story. The people who are standing here behind me today are going to tell their story. Let me tell you about Esther Hawkins from Worcester. Her son, this little handsome young boy here, he has autism. Esther fights every day to find coverage for him. I want to tell you about a family, Laura Nicodemo from Jackson, Ohio, in Stark County. She has a sister who had diabetes all her life. Her diabetes became a death sentence for her. Jack Hillier from Worcester. He suffered a heart attack and has been suffering ever since to find health care coverage. These are the stories. These are the faces behind this debate. These are the faces of Ohio. These are the faces of my district. And this is the decision that we have got to make today. I want you to hear from them. I want you to listen to their stories. Listen to what is happening in Ohio. Esther?
My 10-year-old son, Jay, was born with autism. Because of this, he was and is consistently denied coverage by insurance companies because of his pre-existing condition. It pains me to see my 10-year-old child not be able to receive health care coverage because the insurance companies feel he's too much of a liability.
This is Laura Nicodemo from Jackson Township in Stark County.
My sister Rebecca had type 2 diabetes. She had the money and was willing to purchase health care, but was constantly denied coverage by health care insurers for this pre-existing condition. Because of this lack of coverage, she could not afford a good doctor and proper diagnosis of multiple sicknesses. This ultimately led to her death on November 20th, 2008. If Rebecca wasn't denied coverage for her diabetes, she would have received proper treatment and may have been able to join us today.
Hi, my name is Jack Hillier. I suffered a heart attack in 2002. When I arrived at the hospital, they had told me that I had a lapse in coverage and insurance was not going to cover my treatment. Since this heart attack, I was denied coverage from insurance companies due to my pre-existing condition of diabetes and the heart condition. This forced me to pay out-of-pocket expenses, causing me to lose my home, my transportation, and all of my assets.
These families are the face of the 16th Congressional District, they're the face of Ohio, and they're the face of America. And a nation as wealthy as ours, where we can spend $1 trillion on war, certainly we can find the resources to reform a system that is causing people to suffer so greatly. This is a difficult time for our nation. Many people are frustrated. They're angry at what is happening here, and they're angry at the displays and the arguments that they see in Washington, D.C. I also remember that the world is changed not by critics but by leaders. And today, I hope and I pray that we can get this job done for the American people. Thank you for coming today, and we'll answer some questions if you have any.
So just to be clear, that means you're going to vote for the bill?
Yes, I will be voting yes for the bill. Yes, I got a deficit reduction of $1.2 trillion in the second 10 years and $138 billion in the first 10 years. And I got coverage for these for these families here in my congressional district.
Under the president.
One second. Yes, I was very...
Ladies and gentlemen, let me explain to you what you are seeing here, why this is significant. This Representative Boccieri you're seeing here, he has just come out. He is one of about 30-plus Democrats right now who a lot of people know how they're going to vote. Well, we can cross him off the list. He just explained, he went through it in detail, if you will, made kind of gave a long speech, a little bit of a reading of a news release in some ways. Also had families there from his district explaining some of what they've been going through, the hardship they've had when it comes to their personal health care stories. And then he finally stepped back to the podium, and a lot of the reporters were waiting through all that. Sir, you didn't explain to us what your vote was going to be. And yes, he just says he is now on board, going to be voting in the House for